you need to distinguish that from the nerves. So just like it's a liability to cut a curved aortic and to cheat the owner, this is exactly a liability if you want to cut this ligament of the air duct. Ligament of the air duct. You see it's glossy and you can see it on the cadaver pretty well. And if you don't see it, then you need to see it. Okay? This can be confused with the nerve, the palmar digital nerve. When you cut, make sure that you avoid cutting the ligament of the air duct. Does that make sense? Avoid cutting the ligament of the air duct. Please. Okay. Well, not please. Who cares? You're going to be sued. Okay. So, the next step, if you've eliminated the pain 100%, then you've diagnosed the disease. It's mostly, you know what? Navicular. Actually, there are other diseases in the caudal portion of the what? Of the caudal third of the hook. However, we are concerned now. This is one example, okay? You can give me 4 other different ones in the exam. Now, the neck, if we did not eliminate that, okay, we need to go to the abaxial. Abaxial means along the axis of what? Of the proximal sesamoid bones. Proximal sesamoid bones. And as you can see here, this is the fetlock joint right here. This is the fetlock joint. On either side, you have what? You have the proximal sesamoid bone. On each of these sides, you see the bundle that I was talking about down there, which is what? Artery, vein, and nerve. Vein, artery, and nerve. Vein, artery, and nerve. The vein usually is more superficial, right? Why is that? Because it's part of the thermoregulatory center, right? So the horse or you or anybody else can lose some temperature when it's very hot, right? Remember that, right? No, you don't. So, okay, so the bundle is the very first thing that you need to palpate. Roll it to the side. Again, you see how it's rolling under my big thumb? You can see that, right? Don't use your regular finger like Rufus. Your thumb, okay? Your thumb, okay? And then when you take it to the side, what you do is you give the injection to that side. Along the axis of the proximal sesamoid bones. Along the axis of the proximal sesamoid bones. And of course, it's gonna, with this nerve block, you're gonna basically eliminate any pain in the digit, basically. But not the fetlock joint, because you did not reach the structures of the fetlock joint yet. Okay? With this, you're gonna eliminate what? The desensitize what? The palmar, the medial and lateral, palmar, digital, or plantar digital nerves, and their dorsal branches. Do not, and I repeat, do not give me half-ass answers here. This is extremely important, okay? Very important, very, very important, okay? And the most important, the most common disease that I will diagnose in this area is what? Sole abscesses, because they can happen in anywhere in the sole, so you can eliminate it, right? Please remember that. Again, the same technique. Roll, inject, let go, the bundle is going to go over the anesthesia, and the nerves will be desensitized. Good stuff? Good stuff. Third, both sides. Always both sides. I said that at the beginning. Always both sides, medial and lateral. Okay? Always, always, always. In the 4 blocks, you do medial and lateral. You do not do one side. Okay? No one side whatsoever. 2 sides, medial and lateral, all the time in all 4 limbs. Okay? You can do it in a standing, you can do it in a flexed position, you can do it while the horse is flying. I could care less. Grab the horse, get the needle where it's supposed to be, and get the anesthesia there. Okay? Every school has their own technique. Who cares? Okay? Do it and do the job right. Number 3rd nerve block is the low polar nerve block. Low polar nerve block. And that basically, the landmark, get a still done. That basically gets the metacarpal nerves, both medial and lateral. So, get one with two decent splints. So okay. So the landmark for this low polar is you need to feel the bottom of the what? of the splint bone, the bottom of the splint, you have to brush the whole metacarpus area with your hand. Brush it, brush it, brush it, until you feel at the end of your thumbs, not fingers, thumbs, what? The end of the splint bones, which is basically the what? The buttons, okay? Now the landmark is what? Is to give 4 injections, not 2 injections in this nerve blood. 1 on each end of the splint bones, 2 and 4, medial and lateral, right? 2 injections. And the other 2 injections are what? Are between the superficial and the deep digital flexor. The superficial and the deep digital flexor from each side, medial and lateral. So you have 2 between the tendons, medial and lateral, that's what? 2 injections, and you have 2 at the end of the splint bones, which is the buttons. That's a total of how many injections? 4 injections. That's why they call it low 4 points. Low 4 points. Low 4 points. Okay? Repeat that. Low 4 points.